Yes, there is skepticism, doctor. Let's talk about hope. We are very close to getting this shot into people's arms. What are you thinking right now?
I'm thinking it's miraculous. You know, the idea that this quickly there is a safe and effective vaccine that is about to start rolling out and doing its thing, saving lives, protecting people. That's absolutely incredible. And, you know, so I've got that feeling of this is probably one of the greatest public health accomplishments in my lifetime. On the other hand, I'm really worried that people are going to take this as a sign that we don't have to do the things that are really going to save lives this winter, and that really scares me.
Getting senioritis, if you will, folks not really thinking that it's serious any longer because they're almost done with COVID or almost done with school, if you're going to take that metaphor to its conclusion.
Yeah, you know, I would say a combination of senioritis where people in their individual behavior may be backing off and the absolute failure of Congress to do the things that are necessary to make sure that people are able to protect themselves, their families, and their communities. You know, most of what was in the CARES package, the supports to people that were given in terms of dollars, those have gone. But all of the other protections in terms of eviction, in terms of mortgage, in terms of utilities, you know, the last of those will go away the end of December, and most of them have gone our way already. And so there are just far too many people, especially in the communities hit the hardest, in Black, Latino, and Native American communities, who don't have a choice. You know, if they've been exposed, if they think that they're sick, there's no choice but to go to work so that they can pay the bills. And Congress could put an end to that, but they haven't. It's been months since they've taken action.
But, you know, we just heard Chris Jan saying, and part of the issue with that is, you know, people are struggling. They're not getting the help that they need. Yes, but they're also losing faith in the government to come to their aid. So this trust is getting eroded. How do you build it back in order to convince people that a vaccine is safe when you've let them down so many other times before?
I mean, that's going to be the big challenge. And there's all different layers of trust. I tend to focus on how do you increase the trust in CDC and our public health system. And for us to be successful moving forward, that's going to be absolutely critical. You know, I hope that the next administration puts the head of CDC or another CDC leading scientist out there every day to answer questions, to talk about what they're learning, to talk about why it's so critical to do these measures to protect people. I hope that we'll see our political leaders standing right next to people from CDC and nodding. I hope that we'll see our political leaders modeling the behavior that we're asking people to do. You can't have public health telling people to wear masks and then see all of your political leaders not doing that. It just doesn't work. That's going to be a start to rebuilding trust, seeing that unity of message and purpose, that it's something everyone in America needs to do.
Well, if past is precedent, we're going to have to wait for a new administration to see that. Let's talk about the Pfizer vaccine specifically. You do need 2 doses for this vaccine, and they were given, I believe, in the trials 21 days apart exactly. Do people need to be coming back to get that second dose exactly 21 days afterwards? Because that seems like it's going to be a really difficult undertaking, if so.
Yeah, no, you don't have to do that. A couple things. One is, you know, when Pfizer posted their information and FDA posted their analysis, an exciting thing is that even after your first dose, a week after your first dose, the protection level was at about 50%. So you get some protection. The 21 days is the shortest interval at which you can come back. You can't get your dose before that, but it can be longer. You know, as a general pediatrician, we're used to spacing doses of vaccines for infants. And it's a minimum period for administration, not a maximum. But there are going to be all kinds of challenges in terms of tracking. You know, people move around, people switch the states in which they live. And for a lot of places, they're going to be tracking this all on little paper cards. And if people lose those cards, how are you going to get that information? Our public health system has been so underinvested in that we don't have the electronic tracking systems that we should have to make it easy to implement something like this. It's going to be very challenging.
Is it going to be enough to take a picture of the card with your phone and have the picture handy for when you need it?
I think that's a great idea. I would hope so. I mean, I do that with a lot of the pieces of paper that I normally have to keep track of. I track them that way. But it will be really important because with multiple vaccine products, you need to make sure that if your first dose is with the Pfizer vaccine, that your second dose is with the Pfizer vaccine. And people aren't going to remember. You wouldn't expect that they would. So taking that picture, that's a great idea.
I do that with my dry cleaning. Dr. Richard Besser, thank you so much for joining us. It is a really exciting time. I hope that things go as smoothly as possible.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.